I have a confession to make. And it's not that I'm wearing makeup, which is actually true. It's a little bit weird. No, my confession is that I stole my my medical records. When the physician left the room, I shoved them in my wife's purse, and we took off. And this didn't happen just once. This happened several times. True story. I'll actually give you my rationale in a few minutes. I'll tell you the story. But here's the thing. If communities in this country can have a focused agenda around information sharing and sharing of information about patients and with patients, we can radically improve health, and we can radically improve the way patients navigate the medical sector. Now, I believe in this mission. That's why we're all here, communities across this country, doing this information sharing agenda. But the truth of the matter is it's really hard, right? It's hard getting people in a room together to talk about things that they don't agree on, especially when they're competitors. Competition is alive and well in our communities across this country, but in Cincinnati, where we have 2.5 million people from Dayton to the middle of Kentucky, there's no dominant health system, no dominant health plan. So how do you give folks a nudge to dip their toe in the water, start finding some agreement and some common ground? In our community, we do this in part by leaning on the civic and business community. We're fortunate to have companies like Procter & Gamble, GE Aviation, Kroger, and Macy's who remind us as a region that our community's goals supersede those of any one particular institution. We also have the luxury of bringing people together to look at data. So having data is a magnet to get people together. And so let's assume you have good data, you have some agreement about the science, about what to do with it, and you have some agreement about measures of success. How do you encourage people to go a little bit further, to take another step? I would argue that you do it by offering them a low-risk opportunity to participate. So in our region, we don't pursue a stick-in-the-eye transparency agenda. We're not out for gotcha. What we do is we bring leaders together. We study data. We learn together. We validate it, test it. We give ourselves and each other an opportunity to improve, and then we start to report together as a region. The work that we do in Greater Cincinnati is part of a global or a national effort here that many of you participate in, and we wouldn't be able to do it without support from the Robert Wood Johnson Foundation. It's been incredibly powerful in our community, but really across the country. I mean, this is a movement that we all believe in and are excited about, and it has a great trajectory. So let me tell you about the medical records. Here's the end of the story. This was about a dozen years or so ago. I had a nasty case of non-Hodgkin's lymphoma. I was traveling across the country trying to get fixed for 2 years, multiple medical centers. And I had this photograph of my 4 little kids with me to motivate me and nudge me along. I still carry it with me today in my wallet. It still inspires me. You parents understand that. At the end of the ordeal, or toward the end, it became apparent that I needed a bone marrow transplant. I had no idea where to go, no information about where to go. And I was worried my records wouldn't be there when I showed up. So I stole them. And I'd do it again. And really, that's what we're here for. We're here to provide information in communities across the country and connect the dots so patients and their families don't have to. Thank you.